Hi everyone, welcome back to our channel Nursing Bharske. Today we will discuss about the most important MCQ for the Norcet, NCLEX and other nursing exam. Let's start. A nurse at disaster scenes is performing triage. Which patient should be assigned a red tag emergent? Option A. A patient with sucking, chest wound and respiratory distress. Option B. A patient with compound fracture of the femur and the stable vitals. Option C. A patient with massive head injury and spontaneous respiration. Option D. A patient with minor lacerations who is walking around the scene. The answer will be option A. A patient with a sucking, chest wound and respiratory distress. Because red triage are the life-threatening. A red triage is a life-threatening injuries that are the treatable with the immediate they need immediate intervention. A sucking wound leads to tension pneumothorax, which fatal but reversible. Why option C is wrong? A patient with massive head injury, no response means it comes under the black. Triage black. Because resources are not used on those unlikely to survive in a mass casualty. Option B comes under the yellow. And option D, it's a minor injury, it's come under the green. So the answer will be option A. Next question. While assessing a patient with a head injury, the nurse notes the patient's arms are extended, adducted and internally rotated with wrist flexed. This is documented as a decorticate posturing. Option B. Decerebrate posturing. Option C. Flaccid paralysis. Option D. Opisthostonas. The answer will be option B. Decerebrate posturing. Decerebrate means extensor. Indicates the severe brainstem damage. Severe brain stem damage to the damage. And decorticate means flexor posturing. The arms are pulled into the core, flexed toward the chest, indicating the damage of the corticospinal tract. So the answer will be option B. Next. A patient is admitted with heparin-induced thrombocytopenia. Which medication should the nurse ensure is available as the antidote for heparin? Option A. Vitamin K. Option B. Protamine sulfate. Option C. Magnesium sulfate. Option D. Acetylcysteine. The answer will be option B. Protamine sulfate. Protamine sulfate is a strongly basis protein that binds to strongly acidic heparin to form a stable salt, neutralizing its anticoagulant effects. And vitamin K used for the warfarin, not for the heparin. Acetylcysteine is the used for the paracetamol. Magnesium sulfate, calcium gluconate. gluconate. So the answer will be option B. Next, in the cold chain system in India, what is the recommended temperature range for storing the polio OPV vaccine at the district level? Option A 0 to 8 degree centigrade. Option B minus 15 to minus 25 degree centigrade. Option C 10 degree centigrade to 20 degree centigrade. Option D minus 2 to minus 8. The answer will be option B, minus 15 degree to minus 25 degree. OPV is the most heat sensitive vaccines, so it should be stored minus 15 to minus 25 degree centigrade, and when it should be kept during short period 2 to 8 degree centigrade for short period at the PHC level. Long term storage at the district or the regional level requires deep freezing to maintain the potency. So the answer will be option B. Next, a pregnant woman at 28 weeks gestation is diagnosed with the gestational diabetes mellitus. Which is the primary goal of treatment to prevent the neonatal complication? Option A preventing maternal weight gain. Option B maintaining strict glycemic control. Option C inducing labor at 36 weeks. Option D restricting fluid intake. The answer will be option B, maintaining strict glycemic control, because high maternal blood glucose can cross the placenta, causing the fetus to produce the high level of insulin, high level of insulin. This leads to macrosomia. Macrosomia means large baby, and postnatal hypoglycemia. Strict glucose control is the only way to minimize these risks. So the answer will be option B, maintaining strict glycemic control. Next, which position is most appropriate for a patient immediately following a liver biopsy? Option A left lateral position. Option B right lateral position. Option C high Fowler position. Option D Trendelenburg position. The answer will be option B, right lateral position. The liver is on the right side. By placing the patient on their right side, the bed or a small pillow acts as a pressure dressing against the biopsy side, preventing hemorrhage and bile leak. So the answer will be option B, right lateral position. Next, the nurse observed continuous bubbling in the water seal chamber of a chest tube drainage system. This finding indicates option A, the lung has fully re-expanded. Option B, an air leak in the system. Option C, normal functioning of the suction. Option D, the system is clogged. The answer is Option C, normal functioning of the suction. No, sorry, this will be, the answer will be option B, an air leak in the system, because intermittent bubbling is curdling is normal. Continuous means continuous means leakage. Air is entering the system where it should not be. Action: the nurse should check the continuous and the insertion side immediately. So the answer will be option B. Next, a 4-week-old infant is brought to the client with reports of projectile vomiting after feeding. The nurse palpates an olive-shaped mass in the epigastrium. These findings are classic for option A, intoxications, option B, Hirschsprung's disease, option C, hypertrophic pyloric stenosis, option D, gastroesophageal reflux disease. The answer will be option C, hypertrophic pyloric stenosis. Projectile vomiting, olive shapes and the visible peristaltic waves are the triad of the hypertrophic pyloric stenosis. Projectile vomiting, plus olive shaped mass plus visible peristaltic waves are the triads of the hypertrophic pyloric stenosis. So the answer will be option C. Next, which electrolyte level must be monitored closely in a patient taking lithium? Option A, calcium, option B, sodium, option C, magnesium, option D, chloride. The answer will be option B, sodium, because lithium is a salt. Lithium is a salt. If sodium level drops due to sweating, diarrhea or the low intake of the sodium, the kidneys reabsorb lithium instead of the sodium, leading, what will happen, leading the lithium toxicity. Patient must maintain the consistent salt and fluid intake. Next, the gold standard of research designs for determining the effectiveness of a new clinic intervention is option A, case control study, option B, randomized control trial RCT, option C, descriptive survey, option D, phenomenological study. The answer will be option B, randomized control trial. RCTs minimize the bias through the randomizations and the control groups, providing the strongest evidence for causes and the effective relationship in clinical practice. Thank you everyone. If you want to test paper topic wise, contact with us. Contact this number. WhatsApp this number. Okay, you will get the lifetime test paper for just 2,999. Thank you everyone. Please like, share, subscribe our channel.